Welcome to the Laramie County Community College Paramedic Program Clinical Liaison Orientation. As part of a one-year program, our paramedic students spend several months building foundational medical knowledge. In the classroom, they practice assessing all patient populations, formulating differential diagnoses, then developing and implementing treatment plans. Students then begin their clinical rotations. In clinicals, students see a variety of patient presentations. They work with providers to see different treatment modalities available, and they begin practicing assessments and clinical skills which help in building critical thinking and muscle memory. When students arrive in your clinical area, they are in the middle of a rigorous year-long didactic program where they gain in-depth knowledge about every organ and body system. They learn how to function in the pre-hospital setting to rapidly assess, care for, and medically treat emergencies encompassing each of these systems. Below are just a few examples: abdominal, respiratory, cardiac, neurological, pediatrics, geriatrics, obstetrics, mental health, trauma, psychological, and musculoskeletal emergencies. Clinical rotations give paramedic students a chance to work with patients after they have learned in-class skills. The students see disease processes in real time and participate in treatment plans and patient outcomes. This helps our students to solidify new important concepts, such as the respiratory rotation after the airway and cath lab rotation after learning cardiology. To continue in the program, each paramedic student must individually demonstrate clinical proficiency in each required skill and perform these skills successfully in the clinical setting. As a future paramedic in the field, these clinical skills must be successfully performed in conjunction with their other numerous responsibilities, such as leading the team, delegating tasks to on-scene personnel, and collaborating with allied agencies, keeping the patients, their self, and the team safe, orchestrating safe patient movement, and determining the order in which skills should be accomplished. Clinical rotations give paramedic students the opportunity to assess patients, see different patient presentations, and to practice, in each department, the foundational skills which they will eventually be performing: patient triage and assessment, IV initiation, airway management, drug calculations and drawing up medications, medication review, and administration. This list is not all-inclusive. The paramedic scope of practice is wide and encompasses a huge variety of skills and abilities. Paramedics perform every step of advanced life support, including, but not limited to, endotracheal intubation via direct laryngoscopy or videoscope and RSI, needle decompression of a pneumothorax, initiation of IV, external jugular, or intraosseous access, performing cardiac rhythm identification and 12-lead EKG interpretation, performing synchronized cardioversion, transcutaneous pacing, and defibrillation, insertion of nasogastric and orogastric tubes to decompress the stomach, delivering babies when imminent and unable to reach the hospital in time, performing neonatal resuscitation, initiation of IV bolus or drip medications as indicated. Paramedics can initiate any medication as directed by their medical control. This is regulated by their national and state scope of practice. But if an emergency requires medication for treatment, the paramedic must be prepared to provide it. Paramedic students cannot initiate blood products. To continue in the program after the clinical rotation, the paramedic student must show competency in all clinical skills. They must complete a specific number of skills and clinical hours successfully before starting their capstone phase. In the emergency department, our paramedic student objectives are venous access and medication administration, airway management and ventilation, patient assessment, emergency condition management, assessing patients and developing differential diagnoses, communication with patients, family, staff, and demonstrating teamwork within the team, professionalism and critical thinking, safe lifting, moving, and transfer techniques, and maintaining infection control. As always, this list is not all encompassing, but these are things that we would like them to focus on. In the respiratory therapy rotation, our paramedic student objectives are patient assessment and history taking, airway management, advanced airway skills, oxygen delivery and ventilatory support, tracheostomy care, ventilator management, respiratory medications, indications and administration, respiratory assessment, auscultation, treatment, and reassessment, and connecting pathophysiology with presenting signs and symptoms is going to be an overall thing that we want them to focus on. In the intensive care unit rotation, our paramedic student objectives are to strengthen patient assessment skills, insert peripheral IVs and perform blood draws as necessary, participate in CPR and airway management, care for tracheostomy patients, calculate and draw up medications and administer them intramuscular, subcutaneous, or IV, identify and participate in treatment of EKG rhythms, perform defibrillation, transcutaneous pacing, and synchronized cardioversion, observe comprehensive care of ICU patients. In the cardiac cath lab, our paramedic student objectives are to gain awareness of cardiac cath lab procedures such as cardiac catheterization, the difference and importance between the right heart cath and the left heart cath, cardiac ablation, and what happens to our patients when they come in after AFib or aflutter. This could be potential down the line. Pacemaker or device implant, synchronized cardioversion, be aware of TEEs to identify clots before synchronized cardioversion and that importance, and cardiac stress testing, what it is and what our cardiology patients are undergoing. Strengthen cardiac patient assessment skills, identify different cardiac rhythms, understand patient throughput when the patients present to the cath lab by any means, and learn about patient preparation, interventions, and comfort measures given. During their pediatric rotation, student objectives are to increase their comfort level and communication with and treatment of pediatric patients, pediatric assessment skills practice, procedural skills, practice communicating effectively with patient and parents, communicate with staff and physicians, enhance critical thinking, exposure to pediatric disease processes that they may be treating in the pre-hospital setting, and become more familiar with pediatric dosage calculations and medication administration. In the labor and delivery rotation, our student objectives are to assist with obstetric patient in the labor and delivery processes, observe BLS and ALS skills as the opportunities arise, assist with newborn resuscitation and stabilization, care for term and neonatal patients, develop diagnostic skills for helping recognize obstetric emergencies and their progression, recognize and manage complications as well as describe the normal stages of delivery, and as always, communicate with the patient, family, and team. In the operating room rotation, our student objectives are to participate in endotracheal intubation, supraglottic airway placement, BVM ventilation, and OPA and NPA insertion. We'll also be practicing airway confirmation techniques such as auscultation, capnometry, and capnography interpretation, learning manual airway maneuvers for difficult airways and pediatric patients, assist in tube securement and head and neck immobilization, understand pre-oxygenation importance, suctioning and patient positioning, and recognize and respond to complications of intubation. As a preceptor, students are aware that clinical rotations are a privilege and they are required to always act professionally during program activities. If a situation arises where the student behaves inappropriately, the clinical preceptor shall address it at once. If the behavior persists, the student may be dismissed from the clinical at the clinical preceptor's discretion. The clinical preceptor will then document the inappropriate behavior and report it to the clinical coordinator, whose information is at the end of this presentation. Examples of violations from the student manual are grossly unethical behavior, grossly unprofessional behavior, gross carelessness regarding safety of patients or colleagues, release of confidential information regarding patients and or clinical education site personnel or activities, HIPAA or FERPA violations, or when a student's behavior or actions pose a potential risk to patients, clinical staff, other students, or themselves. This list just demonstrates some examples. This is not all inclusive. If you have any issues and questions arise, please reach out to the clinical coordination or program leadership. Expectations of the clinical preceptor are to facilitate student learning opportunities. The student does need to be self-motivated and looking for them as well. The clinical preceptor will also directly observe skills the student performs. At the end of the student's shift, clinical preceptors need to please complete the forms that the student presents to you regarding their performance and skills completion. All documentation will be reviewed by LCCC EMS program staff. LCCC EMS leadership contact information is at the end of this presentation. Please reach out at any time. If there are several preceptors throughout the day, for example, in the emergency room where the student moves around a lot to get as many skills as possible, then the evaluations can be completed by the clinical preceptor who spent the most time with the student. All feedback is valuable and greatly appreciated. We want to make this clinical process as smooth as possible and to continue building a wonderful working relationship with you, our valued clinical partners. This will benefit the next generation of healthcare providers as well as our families and community. In conclusion, clinical rotations are a vital phase of the paramedic program in which the student finally gets to see and assess patients presenting with disease processes that the student has learned about from books and instruction through several months of intensive study. This is the time where paramedic students get to practice hands-on skills and develop critical thinking that will be required of them daily in the field. As a clinical preceptor, you are a vital part of this process, and sharing your valuable wisdom and guiding our students through your processes will help them learn, as well as benefit countless patients in the future. Competency is not a moment in time, it is a history of sustained performance.